Ladies and gentlemen, welcome back to the channel. I'm Dr. Dawson, and in today's video, we are going to dive into pain management drugs. So which drug is the best pain management drug for osteoarthritis in dogs? I apologize that this video has taken so long to come out, but there have just been a lot of things going on in my life, especially out at the farm with my dad having knee surgery and me having to run the farm after work. So that is one thing that's kind of been going on and holding me up. One other quick thing before we roll the intro, hold on just a second, is I do have a Patreon that I have just started, and that Patreon is going to focus a lot on getting content just a couple days early, but we're also doing monthly Q&A sessions as well as some other live streams and behind the scenes and some stuff like that that you just won't get here on YouTube. So if you do have any interest in that and you'd like to support me, go ahead and head over to Patreon, link in the description below. So a few of the opening thoughts that I have about this. This video really is about options. So I will tell you my favorite NSAIDs that I use in dogs. However, this really is about what options there are out there. Each veterinarian is going to have a little bit different take on which one is the best and a little different take on which one they prefer. Some of that is going to be data-driven, so depending on the newest studies that come out, but more likely most of that is going to be just what they've used, what they've had good success with, and so that's what they stick to. And there's not necessarily anything wrong with that, but today's video is going to focus on what options there are. Most of the things that are on this list are going to be, to one level or another, successful in managing osteoarthritis in your dog. But some may be better for a variety of different reasons, and if you are a veterinarian or a pharmacologist and you disagree with me, or if you agree with me, I would welcome your opinions down in the comments below, and maybe we can have a little discussion. And this is just my opinion. This is not solid fact, because even going through and talking to pharmacologists, orthopedic surgeons, there really is no solid, this is the best way every time. So the first big group of drugs are going to be NSAIDs. So NSAIDs carry a group of major side effects with most of them. There's one or two exceptions that I'll talk about kind of towards the end of this list that are newer, but they almost all carry a theoretical risk of GI upset, ulcers, kidney failure, liver failure, but most of the time the benefits of an NSAID are going to far outweigh the risks when they're used properly. So when we talk about NSAIDs, we're going to talk a little bit about the COX pathways. I'm not going to get into too much detail. If you want to skip this part, I will leave some chapters down below that you can click through, so you don't have to talk about this part and you can get straight into our different options. The COX-1 and COX-2 pathways, and there's actually a COX-3 pathway that we don't talk about as much. So when we talk about the different pathways, the COX-1 pathway is going to be where most of our side effects occur. So the COX-1 pathway interacts with the liver, the kidneys, the GI tract, and others, and so most of our side effects are going to be caused when our NSAIDs, or our non-steroidal anti-inflammatories, interact with this COX-1 pathway. The COX-2 pathway is the one that we really want to focus on, because this is where we can actually inhibit most of the pain. And so when we're looking at all of our NSAIDs, we want things that are going to be more COX-2 inhibitors. So they're going to focus primarily or specifically on that COX-2 signaling pathway, disabling it and decreasing pain in the process without having the side effects of the COX-1 pathway. And this isn't always possible depending on the medication, but we have some really good medications that we're going to talk about that are very good at inhibiting the COX-2 pathway, but not touching the COX-1 pathway unless they're overdosed or get too high of a dose. The number one drug that I kind of see off the shelf or over the counter that people tend to try to use is aspirin in dogs. And this used to be one of the most common anti-inflammatories and is still, like I said, the one people tend to reach for off the shelf. So they don't have to go to a veterinarian to get drugs. Your dog injures themselves, people just want to reach for aspirin. And this is what vets used to tell people to use. The most common thing is a coated children's aspirin. Okay, so here's the story on aspirin. The typical toxic dose can be as low as or lower than 50 milligrams per kilogram of body weight. But the effective dosing range doesn't really you don't really start to see a good effect from the dosing until you get to 30 milligrams per kilogram. And so these two numbers are very, very closely entwined. And it's very easy to give just a little too much or even start to see toxic side effects at a therapeutic dose. And so most of the time people are either underdosing their animals to where the aspirin has almost no effect or very minimal effect. Or they're going to be dosing their animals at a point where we have a pretty high risk of toxicity from aspirin. And so don't use aspirin. That's my takeaway. Don't use aspirin. There's a lot better options. Talk to your veterinarian. They're not that expensive. Now, the next drug is going to be Deracoxib, or Deramaxx is kind of the name in dogs. Theoretically, it's a very selective COX-2 inhibitor. At normal dosing, it does appear to have very few side effects. And as long as the appropriate dosing is maintained, it is advertised as having a very good COX-2 selection. We don't see a lot of side effects. We see fairly good pain control with osteoarthritis. Overall, fairly decent drug. The next one is Firocoxib, or Previcox is the brand name. And it's very similar to Deracoxib. They're in the same drug class. And in a few studies, it seems to have a little bit better effectiveness than Deracoxib. But this could be due to study bias. I don't really know. Both of them are fairly effective drugs for osteoarthritis. Don't have a lot of complaints about either of them, and they're both have pretty good safety margins with few side effects. Now the next one, and probably one of the more common ones that I see used, is Carprofen, or the brand name would be Rimadyl. That would be the most common brand name. Carprofen appears to have a little bit less control than either Previcox or Deracoxib, but in clinical practice I would say that Carprofen is a very good fever reducer, very good with acute soft tissue injuries or surgery, but we do see just maybe a slightly higher risk of side effects, but very minimal, not really measurable amount. But it does seem to work very well for postoperative pain. There have been very few cases or reports of significant side effects unless it's overdosed. And this is probably the one I prescribe the most because it's less expensive, and this is the NSAID I usually will choose for most of my surgery patients, even for routine surgeries. This is probably the one I use the most, probably not the best for osteoarthritis, but fairly good for the price that it usually is at. Now, Meloxicam is the next one. This is probably one of the most versatile drugs that veterinarians have in their arsenal. And this is because we can use it in so many different species. It's one of the most studied anti-inflammatories in exotics. This is typically my NSAID of choice in most exotic animals, as well as for large animal species for pain. So I will use this in cattle. I have used this in horses. I have used this in sheep and goats. I've used it in reptiles, rabbits. It's very good pain management drug, especially for osteoarthritis and other causes of pain. It does seem to have a fairly low incidence of side effects in most of these species. So tends to be a really good one. I don't typically choose it for dogs because according to the studies, the pain control and how long we can use it, I like our other drugs better in dogs, and even in cats. I think there's better options than Meloxicam. In cats, it does seem to target the kidneys a little bit more than I'm comfortable with for using it long term, but it has been used successfully long term in dogs and in cats. Okay, Galliprant. Now, Galliprant is a drug that took the veterinary world by storm in 2016 when it came out because it is an NSAID, and we see a lot of the same anti-inflammatory effects as a typical NSAID, but it's not an NSAID in the typical manner. It works on the same pathway as these medications. However, it works a lot further down the pathway, as you can see in this graph. So this is a typical NSAID, and it affects the COX receptors. Specifically, we want it to affect COX-2 receptors. Galliprant, or Grapiprant, is actually a drug that will work further down the line on these prostaglandins. And the prostaglandins are a signaling molecule that signal for inflammation and pain. And so we actually are affecting the same result as a COX-2 inhibitor, but it's a lot more selective than a lot of our other NSAIDs because it affects further down the pathway. Galliprant is very specific, and I'm very excited because the price should come down on it soon because the initial non-compete patent, however you want to say that, should be coming to an end, and actually came to an end in March of this year. of 2021, and so I'm hoping we see some generics on the market that'll drop the price here soon. But with Galliprant, we see very few side effects. Even though it works on the same pathway as the rest of our NSAIDs, it's much more specific, which is a fantastic thing. And so this is why Galliprant is actually my favorite NSAID for treating dogs with osteoarthritis, because using it long term, we see a lot less risk of these side effects that we could potentially see with our other NSAIDs. That's my favorite. That's what I'm sticking to. All of them that I mentioned have some use, except for maybe Asprin. And so if your vet uses a different medication, don't worry. The big disadvantage with Galliprant is its price at the moment, which is very expensive. It's the most expensive of the NSAIDs, but it is very effective, and we don't see a lot of side effects. So this ends the NSAID portion of our discussion. And so in the next video, we're actually going to talk about non-NSAID drugs, which kind of doesn't make sense, but they're not non-steroidal anti-inflammatories. They're more focused on the pain aspect and less on the inflammation aspect. And so I have a couple things in that video that I think are going to surprise you. We're going to briefly mention cannabinoids, but we're not going to dig too deep into that subject. We'll dig deeper into that subject in a third video because I think it's just so common right now, and it's a question I'm getting a lot from my clients. If you haven't already, go and check out my other videos about canine osteoarthritis. I have a playlist up in the corner, and I will link it down below as well. So have a fantastic rest of your day, guys. We'll see you in the next video when we talk about some more pain meds for dogs. Oh, and don't forget, if you have any interest in supporting me on Patreon and getting some of these benefits, go ahead and click that link down in the description.